If you've ever skipped wearing shorts on a really hot day because you didn't want to show off your varicose veins, then you're not alone. In fact, over half of us will suffer from them by the time we reach 65. And besides the veins looking ugly, they can actually be dangerous as well. So to tell us more about everything from prevention to treatment, we're joined by Dr. John Alfieri with the Virginia Vein Specialist. Thank you so much for joining us.
Well, thanks for having me.
So let's start off with the basics then, if you would. Tell me, what are varicose veins and what are spider veins?
Well, spider veins and varicose veins are all abnormal veins. They're just sort of, they differ in size. The spider veins are the smaller, sort of red and purple ones you see usually on the outsides of the legs, that don't generally pose a medical risk but can be symptomatic. The varicose veins are the bigger, more ropey, bulging veins that you see more typically around the calf. And those are the ones that are really the medical disease with the veins.
Now, you said medical disease. Does that mean then they're dangerous?
Well, they can lead to complications if left untreated. The most common complication is to get blood clots in those veins.
Oh.
And the second most common is bleeding. With one of the veins that gets nicked, there's a lot of pressure in there, and they'll just continue to bleed and bleed and bleed. So I've had lots of patients referred to me from the emergency room who went in just for bleeding from their varicose veins that they couldn't control themselves.
Wow. Now, some people are a little more lucky and get these more often than others, don't they?
As far as the spider veins go, yeah, there's definitely a family distribution, and that if your parents had them or your grandparents, you're much more likely to get the spider veins. The varicose veins the same, but there are some things you can do to minimize the likelihood of developing the varicose veins, or at least slowing down how quickly you get them.
Now, how do you know that you need them treated?
Any vein that's symptomatic, even if it's a spider vein, should probably be evaluated. Now, whether it needs treatment or not, there's a full evaluation that we do that includes a history and a physical, where we talk about when the veins started and how bad they are and what the symptoms are. But it's usually going to include an ultrasound examination too, where we can look at the veins, the deep veins, and see if there's actually a problem deeper than just on the surface. So even the small veins should be evaluated. The big bulgy veins clearly should be the traditional varicose veins, because as I said, those are the ones that can lead to complications. So really, if you have veins that are symptomatic, either if they're small spider veins, they should be evaluated, and the big bulging veins definitely should be evaluated.
Now, I remember when I was pregnant with my second child, I would get a varicose vein and it would be so painful, it would keep me up at night. Do pregnant women tend to have that kind of, issue in general?
Well, a lot of women will. If there is something good about those kind of varicose veins, a lot of times they'll go away after pregnancy. A lot of it is the uterus is big and it's pushing on the veins in the pelvis.
Oh, interesting.
And it'll cause temporary varicose veins in the legs. If they don't go away, there's a simple treatment to eliminate those, which is just a small injection with an IV needle of some specialized medicine, and the veins should go away. Interesting.
Now, I mean, either if it's cosmetic or if it's a needed kind of treatment, do you guys deal with both?
Yes. Yeah, we have pretty much a full-service, state-of-the-art facility where we'll treat spider veins, as I said, with tiny needles and specialized medicines to eliminate the spider veins, all the way up to the big bulging veins, which is we use state-of-the-art radio frequency ablation catheters, which is just a thin catheter about as big around as the lead in a number 2 pencil.
Wow. And you've got some extreme results here. I mean, that's a big difference in people's lives. And I want to make sure we get this information out there. Virginia Vein Specialists are located on Nationwide Drive in Lynchburg, 434-237-5893, or go to virginiaveinspecialists.com. Thanks so much for joining us.
Thank you.